Hello, fellow classmates. My name is Dee Tennyson, and today I will be presenting Afaf Meleis's transition theory. Afaf Meleis was born in 1942 in Alexandria, Egypt. Her commitment to a professional career was shaped by her mother, who became the first Egyptian nurse to earn a Master's of Public Health degree and doctorates from an Egyptian university. Afaf graduated from the University of Alexandria in 1961. In the early 1960s, she left Egypt to continue her graduate education at the University of California, Los Angeles. There she earned her Master's of Science in 1964, and in 1968 she would earn her doctorates in medical and social psychology. She taught for 34 years at UCLA, and during this time, she developed her transitions theory. She has been married for 50 years, has 2 sons, grandchildren, and she continues to work as a professor for nursing and sociology at the University of Pennsylvania. Meleis's transition theory has 11 assumptions. I'm not going to read through all of these, but there are a few I wanted to elaborate on. Individuals and our families experience change process with different responses and outcomes, even if they are not aware of the triggering event or response. It's basically saying that we're all different individuals and we come from different upbringings and cultures. Because of this, we will have different responses to the transitions that are in our lives. Although we may not always know what's causing us to respond in the way that we do through the transition. Another one I wanted to talk about was the disposition of the experience shapes the outcome. I think that as nurses, we've seen this where basically, the patient's experience during their hospital stay and through their hospital discharge, if it's smooth, free of chaos, and not cluttered with confusion, the patient's transition will have a better outcome. I kind of feel that sometimes there's such a push to get patients out of the hospital that the discharge planning stage is rushed or overlooked, and oftentimes our patients leave the hospital not with a very unclear understanding of what they need to do when they go home. And the next one I wanted to just touch on a little bit was preventive actions and therapeutic interventions affect outcomes. And we are seeing this in healthcare today as the focus is shifting towards preventative measures to keep patients healthy and out of the hospital. Diabetes research has yielded substantial knowledge of effective management of the disease and the prevention of long-term complications. And I believe that the saying goes, an ounce of prevention is worth a pound of cure. I've continued Meleis's theoretical assumptions on this slide, and again, just wanted to touch on a couple of them here. The first one being that healthcare is delivered more equitably by using well-documented evidence. We're all familiar with evidence-based practice, and we use it in our work daily. As clinicians, we rely on experience and expertise to evaluate research findings that can benefit patients. Evidence-based practice respects the patient's unique situation, respects the patient's preferences and values, and it also improves patient care and outcomes. And evidence-based practice is a continually changing model that incorporates updated research. Meleis defines a patient's environment as the physical, social, cultural, organizational, and societal factors that influence the patient's experiences, interventions, and outcomes. She also goes on to say that the recipients of nursing care are individuals, their families, and communities, and that we are all partners in the care process. When patients, their families, other caregivers, and the public are full, active participants in care, the health, the experience of care, and economic outcomes for patients is substantially improved, and transitions are made effectively. Let's look at the major concepts of Meleis' theory. Her initial focus is on the type of transition. She states there are 4 types of transitions. The first one being developmental. And an example of this would be a child that is becoming an adolescent and how they deal with that transition. We're aware that it involves immense physical, cognitive, and emotional changes for young people. The next transition type is health and illness. An example of this would be the recovery process, hospital discharge, and diagnosis of chronic illness. Next is situational. An example of this would be a person that is moving from their home to a nursing home care facility. This transition represents a major life event and can be traumatic. The last transition that she recognizes is organizational. And an example of this would be the ICU patient that is moving to another unit in the hospital and how the patient and family cope with that change. The next concept in Meleis's transition theory is that transitions have patterns. Some may only be experiencing a single transition, but many people are experiencing multiple transitions at the same time. I can say that's true for myself right now as I am getting ready to send my last child off to college, and I myself am working on getting my master's degree. Also, transitions can be sequential or simultaneous. And lastly, transitions can be related or unrelated. The next concept that Meleis explores is that there are properties of transitions, and these properties are, first, awareness, the perception, knowledge, and recognition of the transition experience. Next is engagement, and this refers to the degree to which a person demonstrates involvement in the inherent transition. The level of awareness can influence the level of engagement. And it's at this time that the person makes a choice, either consciously or unconsciously, to be part of the change process. Next is change and differences. Each person deals with transition and change differently. And it's important as practitioners that we consider the client's level of comfort and mastery in dealing with change. Time span. How people deal with transitions ebbs and flows over time, and boundaries should not be put on the time span of certain transition experiences. And lastly is critical points and events. This is the final property suggested by Meleis' theory. These would-be markers of critical points and events are things such as birth, death, or the diagnosis of an illness. These critical points or events are usually associated with increases of awareness of change and more active engagement in dealing with the transition experiences. There are 3 more additional components to Meleis' transitional theory that I wanted to touch on. The first one being transition conditions. This includes those circumstances that influence the way a person moves through the transition. These can include personal, community, or societal factors. And these conditions can either facilitate or hinder the transition progress. Secondly, are patterns of response or process and outcome indicators. If the patient is feeling connected and interacting during the transition, then they develop confidence and coping skills that will help them through the transition and lead to better outcomes. And last but not least is the nursing therapeutics and interventions. These are central to the response and facilitation of the transition process. Assessing the patient's readiness for transition and then educating the patients appropriately in preparation for the transition also leads to a better outcome for the patient, family, and the community. So this slide is showing the diagram for Meleis' transitional theory. Sometimes it's easier to process all the information in this format. The transitions theory is simple and non-complex. The illustration depicts the interrelationship between the concepts. As you can see, the double arrowed lines. The linear progression adapted for the elaboration of the concepts gives a clear display of how the theory relates to nursing and how the subconcepts define its influence. So let's look at how Meleis' transition theory has been put into action. The theory's been used as a framework for many diverse research and applied research projects. And here are just a few that I found. First one was perceived readiness for hospital discharge in adult medical surgical patients. And this study was to identify predictors and outcomes of the adult medical surgical patients' perception of their readiness for hospital discharge. The next one I found was self-care of heart failure, a situation-specific theory of health transition. And I thought this one was pretty relevant, especially over the past 15 years. Heart failure disease management has become an exemplar model of transitional care. And this study looks at the processes used for heart failure self-care. The next one is Meleis' theory of nurse transitions and relatives' experiences of nursing home entry. And I think we're all aware that a growing number of family caregivers are finding themselves in the situation of needing to assist a relative in moving to a nursing home. This study looks at how Meleis' theory is used in this process. And the last one I found was, I found this one interesting. It was titled Military Wives, Transition and Coping, Deployment and the Return Home. I mean, there's definitely no doubt that the family as a whole experiences significant stress when a loved one is deployed to combat zones and exposed to dangerous operations. The objective of this study was to explore the experiences of wives of the deployed soldiers. Practitioners can give better care by understanding how different phases of deployment affect the wife's coping ability and her emotional and physical health. So let's take a look at a case study where we could put Meleis's transition theory into action. In the clinic today, you will be seeing RH, who is a 75-year-old female patient. She has been experiencing some esophageal burning that is relieved by medication. Deeper into your interview with RH, she tells you that she is the caregiver for her spouse, JH, who was recently diagnosed with Alzheimer's disease. Since his diagnosis, she has been experiencing loss of appetite, dizziness, and headaches. Deeper into the interview, it is revealed that RH has a lack of knowledge regarding Alzheimer's. She also tells you that their relationship has become increasingly tense over the last year as he has become increasingly forgetful. Support systems for RH and JH are limited as their son lives 1 hour away and he does not want to be active in his father's care. RH and her spouse never imagined they would have to be dealing with a long-term debilitating illness during their retirement years. RH's role in their relationship is transitioning to the caregiver. She is attempting to manage the budget, yard work, housework, and family care with little emotional or physical support from her spouse or others. RH and her spouse are in transition. As practitioners, it is our job to help her and her spouse through these transitions. The primary treatment goal identified in collaboration with RH was to develop effective coping strategies during role transition from spouse to spouse caregiver. RH states, "I want to know how to handle this so we can live our last few years in happiness." That concludes my presentation on Meleis's transition theory. I hope I have provided you with some more information regarding the theory and how you can use it in your practice as a nurse practitioner.